be here tonight and to welcome everybody to our recruitment town hall. My name is Nicole Reza, and I am the Director of Talent Acquisition for the HCA Mountain Division. And I'm more excited to be here tonight with our panel, and we will introduce them in just a second here. Just to give you a little bit of a background about myself, I've been with our organization for 10 years, and I have to say I couldn't be more proud to be with our organization over these last several months. And so as we were putting this town hall together, really our thought process was just to really share with people what it's like to be part of our organization, and just kind of answer some frequently asked questions that we get from people as they decide to make that journey, that transition to HCA. So with that being said, I want to start with introductions, and I'll just kind of go around. So Jen, why don't we start with you? Why don't you tell us a little bit about yourself, your role, and anything else you want to share with us?
Hey, good evening. I'm Jen Wagoner. I'm the Chief Nursing Executive here in the Mountain Division, so Idaho, Utah, and Alaska, part of HCA Healthcare. I've been with HCA Healthcare for 7 years, and prior to that, with a large system in the Midwest. I'm an ER and ICU nurse by background, but have loved my transition through leadership roles. And this is probably one of my favorites in that I get the opportunity to advocate for our frontline colleagues every day on a variety of topics and really bring the clinical voice into the boardroom at every level.
Exciting. Emily?
Hi, I am Emily Shumway, and I am the Vice President for Clinical Education over the 11 hospitals in the Mountain Division. I have been with HCA almost 3 years, and I most recently came from Banner down in Arizona, and I have to tell you that making a move to a new state, to a new organization has been one of the best decisions that I've made. I absolutely love what HCA has to offer. I love that they care about our employees, and I love that I am in a position to help our nursing staff and our frontline workers be competent and confident in the care that they provide our patients.
We love having you, Emily. Andy?
Hello, my name is Andy Lamoureux. I am the Surgical Services Director here in Orem, Utah, Timpanogos Regional Hospital. I've been with the company for 3.5 years. And I love being back in Utah. I was in Tennessee for the last 20 years, and I'm from Utah originally, and so I'm happy to be back in cold, snowy Utah. I love the snow.
You and like probably nobody else, Andy. Kelly?
I'm Kelly. I'm the HR guy over at St. Mark's Hospital. I've been with the company 12 years. That was last week, so I can't believe time has gone by that fast. And been with 3 facilities, 3 sister facilities here in the Mountain Division in Utah. So happy to be here.
Perfect. And Ashlyn?
Hi, I'm Ashlyn Hall. I'm the Assistant Chief Nursing Officer at St. Mark's Hospital in Salt Lake City. I have been with the company 7 years at 3 different facilities. I have an ER background as well. And like Jen, I got into leadership, not really planning that when I started out my career, but loving bridging the gap between business of healthcare and that bedside clinician, and really serving nurses and the clinical providers that are at our bedsides.
Awesome. Okay, well, as mentioned, we're just going to kind of make this an open Q&A session. So some of these questions are gathered, again, from some commonly asked things that we get from candidates and people deciding to make that transition. So I'm actually going to kick it off with you, Jen, to take the first question. So this one is, people aren't always familiar with HCA, especially here in Utah, right? It's MountainStar, 8 facilities, but people don't know HCA. So can you talk about the scope and the size of our organization and what that means?
You bet. HCA Healthcare is expansive. We have over 180 hospitals, over 2,000 care sites. We're in 21 states and in the UK. Really, when we talk about one company, many careers, it spans the range. We have freestanding emergency departments. We have ambulatory surgery centers. We have physician practices, just a variety of different care settings and locations that you can be a part of. It's amazing, especially in these past few months, to be able to watch the size and scale of HCA be leveraged across the organization, whether that is transitioning colleagues from here to Florida or back and forth to support one another, or sending ventilators to or from Las Vegas or Texas, or the ability to quickly move personal protective equipment across the country from any of our 180 plus hospitals. It's just been outstanding to watch us be able to leverage that scale. In my role and Emily's role, all the roles that are here with you on the call today, with such a unique opportunity in an organization of this size to be able to share best practices and to not recreate the wheel. There's always somebody that we can reach out to and ask questions. And for anybody who's joining the organization, if you want to be a med-surg nurse in Utah and in a year you decide you want to be an ICU nurse in Florida, we can make that happen. There are just so many opportunities, and the size and scale is fantastic, again, not only from a supply chain perspective, but an endless opportunity perspective for our colleagues.
That's awesome. Yeah, we are so massive. It's awesome. Okay, so this, Kelly, I'm going to actually throw this out there to you, Kelly. So when you think of size, sometimes when I think of size, I think that could have a negative impact on an employee. So how we treat our employees. So can you talk to us a little bit about our employee value proposition, Care Like Family, our mission statement, and really some of the initiatives we've carried out over the last several months and how that's impacted our employees?
Yeah, you bet. You hit it right on the head, Care Like Family. Jen hit it a little bit in her first answer there in terms of PPE. All of our employees here at the hospital throughout HCA as an organization have never had to go without PPE because of the scale of HCA and the ability to move things back and forth. One of the things that you saw with HCA in the last couple of months is HCA does care like family, and the individual employee is affected by that in terms of we offer pandemic pay. Pandemic pay was paid that if the census went low, which it did for several months throughout the nation, the employee was able to stay home and be compensated for their time, up to 70% of their pay. If an employee of ours caught COVID, an employee was able to stay home and get quarantine pay, 100% of their pay. In terms of resources, a lot of companies cut back this year, a lot of layoffs. HCA has 275,000 employees, and not one of them was laid off because of this pandemic. So we've been able to save every one of our colleagues in their jobs, even to a point where in November, next week, we will be giving every one of our colleagues a pay increase, a base salary pay increase. In addition to that, because they've missed that pay increase this year, most of the year, we'll also be doing one-time payments and bonuses for all the employees who stuck with us and stuck it through and really dug in there to help with COVID.
Yeah, that's exciting. So you talked a lot about things that have a financial impact. So actually, Jen, I'm going to come back to you on this next question. So COVID has had, obviously, it's wreaked havoc on tons of organizations. Everywhere you look, businesses are going out of business. They're not able to sustain. And healthcare has been particularly hit hard during this time, just obviously with the influx of COVID patients, but also just, cutting back on normal surgeries and whatnot. But can you talk about HCA and our financial resilience and how we've been able to weather the storm, if you will?
Sure. We recognize at HCA that the pandemic has had a different impact for each individual household, for individuals with their children in school, just a variety of different things. And when you think about business and industry, as Nicole mentioned, there have been a number of businesses that unfortunately have not made it through the pandemic, whether those are small local businesses, those are agencies that, maybe produced a product that no longer was needed in excess, and some healthcare companies in terms of mergers, acquisitions, and looking sort of for the next way to stay afloat. We're really fortunate in HCA that not only do we have size and scale, we have a fantastic leadership team who's always thinking ahead and helping us be prepared. And so it's not just within the pandemic that we pay close attention to cost management and that we are fiscally responsible in the decisions that we make, but particularly during the pandemic, we had the opportunity as leaders to kind of band together and say, in order to make sure that our colleagues have what they need and we can provide hotels for employees who feel like they need a place to stay during the pandemic, or the pay that Kelly talked about earlier in pandemic and quarantine pay, we're going to give up some of our salary during this pandemic to make sure that we are in a position to be financially resilient and take care of our frontline colleagues who are taking care of our patients every day. Now, we're fortunate, as Kelly mentioned, that those colleagues are going to be able to kind of make up any losses that they would have had for for pay increases that were delayed throughout the year. But we did those things in stepwise fashion to ensure that each and every decision that we made would leave us in a financially sound situation. We're also able to leverage scale and make sure that we can get the best pricing, as an example, for surgical supplies. And when you have to flex down and you have to think about not doing surgical cases to make room for COVID patients, and we have the ability then to use our fantastic education team and flex resources from those departments to be able to cover those higher acuity patients in the case of the pandemic or COVID patients. And so it's really just the ability to be nimble and flexible, but also to harvest best practices from around the company. So when you reach out to your colleague in Florida who's just been through the surge to say, what are the ways that you thought about expense management? What are the ways that you thought about staffing differently to support colleagues? What are the ways that you got resources for your colleagues so that they felt supported emotionally during this hard time? All of those ways that we can leverage other folks who have already been through the ground that we are now walking has just been remarkable. Again, not just from a resource, asset, and financial resiliency perspective, but the ability to continually reiterate kind of the best practices and provide the best experience to our patients and colleagues.
Yeah, that's great. Awesome. Okay, so then this next question, so we've talked about how we've supported our employees, so we've talked about some financial resilience. I'm going to actually give this next question to, I want to give it to you, Ashlyn and Andy. I kind of combined your names there. But this question, I want you to think about your teams, right? So obviously we would not be able to be where we're at without our colleagues, without our teams, without our employees. So what are you most proud of, the both of you, when you think about your teams and their ability to get through this season of COVID?
Go ahead, Andy. You can get started.
Oh, okay. Thank you. I just first off want to say I appreciate everything that's been said so far in this session here. It's everything that has been talked about is it's been fun to see and observe from the front lines here. I have been so impressed by our staff. In fact, we spend a lot of time training and helping ensure that people feel comfortable and competent with what they're doing. And this is not something that we planned for, and we didn't train for this. And the neat thing about it was everyone, all the frontline staff, instead of running away, which they certainly could have, they actually ran to the fire and they asked me what they could do to help. And I was asking them to do things that they never could have imagined would ever be asked of them in their career. And pretty remarkable to see them just step forward and rise to the challenge. And it was a big challenge, and super impressed. And I couldn't be more proud of our team here in the MountainStar division, as well as here locally at Timpanogos. Our team just worked like I can't even say enough about impressed and how much energy existed even during this really critical time. So our leadership, our nursing leadership, and our hospital administrators were very supportive and just so helpful. Even at times on the front lines themselves, swabbing patients and staffing, cleaning rooms, and doing whatever they needed to do to really help us through this really challenging time. So I can't again say enough. I'll turn it over to Ashlyn so she can compliment that, hopefully.
Thanks, Andy. Yeah, I actually have some of the same sentiments, and Kelly and Jen have already touched on a ton of the things that I was going to talk about, actually. But resilience is one of the things that just comes top of mind. You know, I have had zero people say no to the challenge, right? They're standing up, they're reaching out to one another, they're supporting one another like family, and it really is astonishing. You know, we have a director of volunteers that's out pushing beds and cleaning rooms and doing things that are well outside of her scope normally, and happy to help and support one another. And that's really inspiring, right? And watching the teams just shift their dynamics through this change and really adapt and evolve in a pretty fluid way has been very impressive. And sometimes we're not sure, right? We're navigating this together, though, and so really the team dynamic has just been astonishing. And being able to leverage our scale, like Jen talked about, where we've reached out to other facilities, we've thought about best practices from other areas. I just can't say enough about the company and our local organization. I just wouldn't be anywhere else. Couldn't possibly imagine being anywhere else.
That's awesome. You guys make me more proud, again, to be part of our organization. So thank you both for sharing that. So let's just jump into the next topic. Kelly, tell us about our benefits and everything that we offer our employees.
Okay. Well, I think the first thing, like we just touched upon, is the biggest benefit with HCA is the people. So we've got great people. One of our founders, Dr. Frist, who was a physician, said good people beget good people. So we've got those benefits right there. That's the biggest one. But I know that's not what you're asking. So what we'll talk about real quick is medical benefits, right? We've got great medical benefits through United Healthcare. We drive people to our facilities, which is the best care we can provide to our colleagues. We have medical and dental and vision. We've got, if you have a pet, we have pet insurance, auto, home, life. We have identity theft, which is a big one. My wife's identity got stolen last year, and our identity theft protection covered all of those costs to get her identity back. I still don't know who she is, but identity theft is there.
Kelly.
Like Jim mentioned earlier, we also have the ability to transfer within facilities and keep all those benefits. So my seniority date of the 3 facilities I've been to, everything stayed the same. So my medical benefits didn't change. My 401k match didn't change. We've got a great 401k match that's unrivaled in the market in terms of the longer you're here, the more the company matches your contributions. So if you're here 25 years plus, you have a 9% match on your 401k, which is wonderful. Nobody does that. Because we're a publicly traded company, we also have an employee stock option purchase program. So if you were to have bought stock 2 years ago at $43 a share, you get it for 10% less. It's now trading at $130 plus per share. So, you make some money there off the company you work for, which is great. So, and then we have great reimbursement in terms of educational reimbursement. And then obviously our education department does a wonderful job of making sure we have continuing education for all of us, and especially our nurses and our frontline staff.
Awesome. So you started talking about something. You started talking about our education benefits, and we have Emily here, right? Our VP of Education. So Emily, I'm going to turn this next question over to you. Can you tell us more about, some of the educational benefits that HCA offers, but then also to talk to us about your role, your team's role, and how you support clinicians, our nurses, and our facilities? Oh, we can't hear you, Emily.
I apologize. As Kelly mentioned, we have great education benefits for those pursuing higher degrees, and we, as HCA, have not just worked with one provider or 2 education providers, but we have 6 education providers that we have partnered with across our enterprise in regards to really supporting those nurses who are going back for their BSN or their MSN or their DNP. And what it means to have a preferred education provider available to us is that in those 6 different schools, nurses are able to look and decide which of the programs are right for them. And some of those, all of those 6 schools have a decreased tuition benefit so that they're not paying what normal attendees would pay at that college, as well as we have some of them are no out of pay at all for the employee, that they wait until they receive the HC reimbursement to pay for their tuition. And so it is a great benefit for our nursing staff to be able to really choose the right time, the right program at a discounted rate. And like I said, sometimes no money out of pocket. And aside from those actual formal academic pursuit, we have an amazing education structure here at HCA. So as you've heard in some of the previous answers in regards to our response through our COVID and PPE and the education that was needed in regards to the changing ways that we were looking to care for patients and protect ourselves, we have a centralized education model so that we are able to leverage our skill with our education team and support partners at our corporate level to be able to give us that guidance. So we had a key person who was working with CDC to be able to understand what the latest PPE needed to be and the latest care. And we were able to, in a nanosecond, turn on that and get that education out to our caregivers. So those at the bedside had the latest and greatest. And sometimes, because it was a new virus, though that direction was changing, on a frequent basis, but we weren't having to independently as a hospital or even as a division try to figure that out. We had support right straight from our corporate partners that was the best and the latest from our CDC. And so in that centralized education model, we also have great support in regards to the ongoing education that our nurses need to be able to be competent and competence, like I spoke about at the beginning. And so our ongoing education and professional development that we have to be able to offer our nurses is incredible. We have national certification prep courses. We have the exam fees are covered. There's a bonus attached for those who achieve that level. We have an annual and yearly assessment of what skills need to be validated. And we have a team then across the entire division, 8 hospitals in Utah, 2 in Idaho, and 1 in Alaska, that we have boots on the ground, manpower to be able to really support our nurses and our frontline staff in making sure that they have the education, the resources they need to be competent at the time that they take care of their patients.
Great. Your team does such great work. It's amazing. So you talked a lot about benefits that are specific to people that are already in our organization. But do we have anything that we offer somebody that's new, perhaps a nurse, that you could talk about for us?
I could take the whole time and talk about this benefit because it is incredible what HCA Healthcare has for our new graduate nurses. So we have a program called StarRN, and it is a year-long program. And so it's in all of our specialties that we are able to pull a cohort together. There is didactic, there are hands-on, there is skills, there are simulations that really prepare these new grad nurses to then go and meet with a preceptor and be able to apply that in the specialty field that they're going into, and being able to then have a residency program that supports them their first full year to make sure that they have the best foundation as they move into this new career. And so we really, when I talk about the med-surg, the tele, the ED, the ICU, the OR, the women's, NICU, peds, like we have it all. And I have been a nurse for 24 years, and I have never in any of my organizations we've never had this type of offering for our new grad support like we do at HCA Healthcare.
Yeah, StarRN program is top notch. So that is how we support our new nurses, right? So, but what about if you were interested in like growing in your career? Jen, let's say I start off as a nurse and then I want to grow into a leadership role. Could you tell us a little bit more about our executive development program and what that is and how it could support somebody in their career growth?
So Emily talked a lot about our onboarding and the way that we think about successfully helping you start a career, especially in nursing within the organization. But as I mentioned before, there are endless possibilities once you are a part of HCA, whether that is geography or the type of role that you're interested in. So when you come in and you want to begin to develop an additional skill set, we have a fantastic leadership and organizational development team that can connect with you and begin to meet those needs depending upon what they are. So for example, if you are new to a charge nurse role or you want to move up into a more formal leadership role, we have charge nurse classes. We have a certification program that allows you to take 6 core classes and become certified in the charge nurse curriculum. It takes you through lots of different things, whether that's having a difficult conversation or how to think about the business of healthcare. And then as you continue to progress through your career, we have more formal programs like the Director Development Program. It's an opportunity for up and coming leaders to be a part of a cohort of learners who really spends a year learning everything they need to know about the director role before then transitioning into a director role in the organization. So they have a year of mentored time where they have cohorted learning, they have hands-on learning, and they get to spend time under the wing of an experienced HCA director. And once you're ready to move on from your director role and begin down the path of associate administrator or an associate chief nursing officer, we also have the executive development program. And so similar to the director development program, you have the opportunity to learn with a cohort and to begin your career, your next level executive career, with a great team who can support you and get your feet underneath you, really teach you everything you need to know about executive leadership from the foundation, and then get you off to a great start in your executive career. So lots of different formal programs across the organization to help take you to the next step, no matter what that is for you.
Of that, because I've been with organizations before where we oftentimes put people in leadership roles, but without really developing them, and that's not going to lead to success. And so I love that we have so many options to help develop people. So Ashlyn, you actually have a really interesting, I guess, career path, if you will. Can you kind of, oh, we're getting the call. Let that pass. There we go. So I was saying you have a really interesting kind of career path, if you will, or you've really made some transitions over the last years. So can you tell us about kind of your nursing career and where you're at today?
Sure, absolutely. So I'm actually like the poster child for everything that Jen just talked about. So I actually started my career with HCA as a staff nurse at Lakeview Hospital in Bountiful, Utah. I was hired in as a night shift nurse. And it was amazing because within like a 6-week time frame, the CEO knew my name, which sort of astonishes me, right? Especially the bedside night shift nurse. That doesn't happen. But that's part of the benefit of HCA, right? It's care like family, right? So you get this small facility and they love you as that care provider, as that staff member. And so I was able to develop my skills at that hospital, become a charge nurse. I transitioned to a house supervisor role, which got me exposure to more of the hospital and more leadership roles. When you start in nursing, you often think, I'm going to be at the bedside forever, right? And I'm going to love on these patients forever. And little did I know that leadership is just that tenfold, because I get to take care of nurses every day that take care of patients, right? And so after the house supervisor role, I was actually given the opportunity to participate in the director development program. And I was able to spend a year at Ogden Regional, where I learned under a fantastic director and got to experience what it is to be a day in and day out first-line supervisor, first-line leader, and to understand the tactical pieces of the puzzle that it takes to run a department. And so I spent time doing that. I got to go back to Lakeview as their director for 3 years. And then I now am currently in the executive development program and have transitioned to St. Mark's Hospital as the assistant chief nursing officer under that leadership. And I'm in a learning phase again, and it's been astonishing. A great learning curve. It's been a whirlwind. I've been here a year, and of course, COVID year, right? But it's been a great learning opportunity, and I feel like these programs and this formal learning that they've provided has given me a tremendous tool set to be able to be a successful leader and develop those that are working with me to help them be successful in their careers as well, and to be the best clinicians that we can be at the bedside.
You are the poster child. That's so cool. That's awesome. Okay, Andy, this next question is for you. So you and I were recently having a conversation about culture in HCA, culture in departments. We were talking about your hospital and how awesome we thought the culture of your facility was. So when we talk about that, can you kind of share with this group like what that means to you and what that actually means to somebody that's a potential candidate that would be coming to our organization to join the HCA culture?
Yeah, thank you, Nicole. Actually, I can say to someone coming from the outside, you won't be disappointed. I have thoroughly enjoyed my experience here with HCA. As I mentioned earlier, I came from a a facility that worked alongside of HCA corporate office in Nashville, and it was a predominant healthcare system there, and I loved that experience. I was in for a treat, quite a big treat when I came to HCA, and I think that, like Ashlyn said, it's where your CEO, CNO, and all of your O team, your administrators, actually know your name, and they know many of the staff, if not all the staff names. It's quite incredible. Coming from a very large system in Nashville, the culture wasn't bad. It just was a lot different, and I think they HCA really wraps their arms around you and wants you to be successful. I think we've talked about that a little bit as well. And I'm also a product of the education reimbursement, and I'm so grateful for that. That really helped me a lot. And so they kind of put their money where their mouth is at. I think that HCA, like Kelly mentioned earlier as well, the culture here is bar none incredible. And I think HCA has really proved that these last several months, as also been mentioned. The neat thing, I'm going to silence my phone. So I've taken some notes and just been thinking about what I might say. I guess I would just end on, you won't be disappointed. Our culture here at this hospital in particular, and I know it's the same across of the division, is we're happy. People want to work. They want to work hard. They want to take care of our patients, and they want to take care of their patients like they're their family. And I've really seen that especially this last year. They're passionate about what they do. They come in not knowing what type of care they'll be able to provide, and we give them all the tools and all the resources to do their job, and to do their job with perfection and excellence. And we support our staff. When it comes to frontline staff, whenever I'm dealing with things, issues or whatever questions they might have, I'm always given. It's always caters to the staff. And I just love that about HCA. I love that we give our staff a voice. I would not have a problem calling Jen and asking her questions. I feel very comfortable about reaching out to other facilities. I think it's already been mentioned as well that it's great to be a part of such a big healthcare system that I don't have to, when someone asks me about what I'm doing here, I don't have to be the expert. I can actually reach out to St. Mark's Hospital or another facility to get the answers that I need. And I love those resources. I text frequently my peers. We have a text tree and we communicate often. And I love that I can do that. And I just didn't get that where I came from. And so anyway, I think that answers the question.
It does. And I will say, like, in my role, I think I have a unique spot. I mean, Jen too, and obviously Emily, but like, I get to go to the other facilities, and I feel like every single facility has the same feel, right? You know, they're different staff, different people, but every facility you go to, I feel like it just always feels like family, no matter if I'm going to Anchorage or if I'm going to Idaho or I'm going to one of our Utah facilities, it always feels like family. So I think that you definitely answered that question. So thank you, Andy. So getting to the bottom of our discussion tonight, this last topic, it's a topic that is definitely, I think it's a really important one, very relevant topic, and that's the topic of diversity and inclusion and HCA's commitment to that. And so I think, Kelly, I'm going to actually throw this one at you.
Sure.
So can you talk to us a little bit about HCA's commitment to diversity and inclusion, but more specifically, can you talk to us about our Chief Diversity Officer, Sherry Neal, and how she supports that commitment for the organization?
Yeah, absolutely. So Andy just mentioned it, and I think it's been mentioned several times, but HCA is care like family. And so it doesn't matter what background you come from, we're going to open our arms and welcome you in as a colleague and as a family member, frankly. At big facilities, small facilities, people know your name. One of the things that Sherry Neal does is she has a program that we've rolled out for every facility within HCA, and we talk about, we have brave conversations. We talk about what it's like to be a minority. What is it like to come from a different unique social background? What is it like to come from a different country, or different professional environments? And we have those conversations with each other on the floor. We have them in the departments. We have them in formal meetings. We're not afraid to talk about it. And as a whole, when we talk about those things, we get better, we gain understanding, and we gain respect for each other so that we can care like family. So Sherry Neal's done a great job rolling it out. We've got a lot of champions in every single hospital, every single division who carry that flag forward for us.
Yeah, absolutely. And I love that the way that HCA has actually made it okay to bring some of these conversations to the workforce. I can remember, there's a lot of things that are taboo. We're in HR, right? Like, you don't talk about these things, but I love the way that HCA has allowed these conversations to happen. So thank you, Kelly. Okay, we're going to wrap it up. So thank you guys so much, first and foremost, for sharing so much great information for people. I think a lot of good things that people can wrap their hands around. And so assuming people are listening to this for the first time, they didn't know much about MountainStar, they didn't know much about HCA, what would you say to somebody who is on the fence? They've really been thinking about making the next move. They've really been thinking about choosing HCA as their organization. They've been on the fence. What would you say to somebody who is in that position right now? And I'm going to start with Andy.
Oh, wow. I already said it. Do it. You won't be disappointed.
I like it. Man, a few words. I like it. Kelly.
I would tell you that there are good people everywhere, but good people surrounded by support and structure from a corporate office and a company can do wonders, no limits. So that's what I think the benefit of joining HCA, good people, plus all the support you need to be successful in your career and take care of patients.
Okay, let's go to Emily.
Thank you. For those who are on the fence and considering, you need to think about having an employer who cares about you. You've heard about that care like family, who has engaged leaders, who has a commitment to not just our patients, but each and every one of us as an employee that wants what's best for you personally and professionally and has resources in place for you to achieve all your goals that you would ever pursue, both personally or professionally. Like Andy said before, you won't be disappointed.
Awesome. Thank you, Emily. Ashlyn.
So HCA has definitely made an evangelist out of me. I mean, I will shout it from the mountaintops, right? So I cannot just be more grateful for the effort that they have put into me and the dedication that I have to this company. It's just reflected in my daily work. I would want to be cared for at an HCA facility. I want my family to be cared for at an HCA facility, and I will never work anywhere else. So come on, people, let's join.
Thank you, Ashlyn. Okay, Jen, I'm going to give it to you to have the final thoughts on this, and we'll close it up.
I am clearly fortunate to be surrounded by amazing leaders, all of who have given you their why and told you that you should just come do it. You won't be disappointed. And I'll just close by saying that above all else, we're committed to the care and improvement of human life. That means our patients, but that also means you and our colleagues. Come on over. We'd love to have you.
Awesome. Well, thank you so much for joining us tonight. Really excited to have been able to get this amazing group together. And so at the end of this presentation or town hall, if you will, there's going to be some additional information on how you can reach us. But if you are interested in looking at our career opportunities, you can visit careers.hcahealthcare.com and see all the jobs that we have open for MountainStar, but also across our organization. And so we're just excited for you to be able to watch this and to learn more about us. But thank you so much for your time this evening, and we'll talk to you all soon.